Hi, I'm Ciara, and I did my project on the professional relationship between pharmacist and pharmacy technician in a community pharmacy. A community pharmacy is like your normal retail pharmacy, like Walgreens or what used to be Rite Aid. And it's just a little different than long-term care or hospital and things like that. So the relationship between the patient and the pharmacy and pharmacy technician is a little different. So, the professional relationship between pharmacist and pharmacy technician is one of importance in the pharmacy industry. So important that it is taught in the curriculum to pharmacy students in pharmacy school and pharmacy technicians in their programs. Being mindful, active listening, and self-awareness are all a part of teamwork that keeps the workflow moving and fulfilling its purpose, which is another part of communicating effectively. My first section that I pointed out in my report is listening, active listening. As a pharmacy technician in a community pharmacy, you're often the first and last point of contact with the customer. So asking probing questions and being a good listener can effectively and efficiently make this interaction easier for both parties. As a good listener, you must receive the messages the customer is giving you, understand what they're trying to say, and be able to reiterate that to the pharmacist. At this point, it's the pharmacist's job to be an active listener when the technician is giving that information, so they're able to reiterate and educate the patient effectively. My next section is on mindfulness. The principles of mindfulness include setting an intention, being fully present, remaining open and non-judgmental, and relating to others with compassion. It also includes being open to new information, points of view, and avoiding relying heavily on first impressions. Often, the technician has dealt with each patient on an individual level, just day to day, whereas the pharmacist only deals with patients that have asked for consultation or have had a question for the pharmacist. Technicians deal with each patient individually and may know something the pharmacist may not. When I was a technician, I dealt with a patient that had military insurance that only covered brand name drugs and not generics for certain prescriptions. So the pharmacist was unaware of this and quoted a price to the patient that was very high and upset the patient when she heard. Since I had that knowledge involving her insurance, I was able to step in and bill the correct drug. The patient was grateful. She rolled her eyes at the pharmacist and made a point of thanking me directly. I could see this annoyed the pharmacist I worked with, but she was open-minded about the situation. She thought before she reacted and looked at it from my point of view. Instead of acting harshly to me, she thanked me and gave me the opportunity to explain what I had done for the patient and some tips about military insurance to use in the future. Now, as a technician, it's important to be self-aware in the pharmacy. Although you have not had the same education as a pharmacist, that doesn't mean you're not as important. This section is on self-awareness and how it leads to self-esteem. This means that you should not take criticism from a pharmacist as belittling or negative. Your self-awareness is what leads to high self-esteem and will help your confidence level when dealing with figures of authority and customers in the pharmacy. Over the past 10 years or so, the community pharmacist and pharmacy technician role has been more clinical and customer focused, respectively. I got this information from Kohler, Tamra, and Andrew Brown, an article documenting the evolution of the relationship between the pharmacy support workforce and pharmacies to support patient care. Many community pharmacies have implemented programs where the pharmacists give more clinical advice to patients and technicians are able to suggest health-related products to patients, as well as give vaccines, suggest vaccines, and refer the patient to the pharmacist for education when they deem necessary. This is where much of the teamwork comes into play outside of counting medications and regular workflow. Pharmacists having a more clinical role is also meant to help with patients relying on doctors and nurses for questions and concerns. Normally you call your doctor or your nurse or you set an appointment when you have a question or a health concern. Well, you can also call your community pharmacy and speak to a pharmacist and ask them a question because they actually have the same medical degree. They just don't go through like surgery training and things like that. Effective communication between customer, pharmacist, and technician is pertinent to the success of us being able to add a more clinical role to the pharmacist. So, conclusively speaking, being an active and good listener, Being mindful and self-aware are all important in the community pharmacy and to the relationship of customer, pharmacist, and technician. Effective communication can benefit all parties and further the goals and plans of the healthcare and pharmacy industry daily. Being open to new information, responding and giving mindful feedback, and taking constructive criticism graciously are all ways to achieve our goals in the community pharmacy effectively. Thank you.